Hi, my name is Sandy Funk, and I'm a licensed and certified speech-language pathologist. I'm here at the Speech Studio to discuss stuttering. Stuttering is characterized as an abnormally high frequency and/or duration of stoppages in the forward flow of speech. Everyone experiences normal dysfluencies, but stuttering differs because they occur more often and longer than the typical speaking errors. Typically, a repetition will happen 3 or more times, and an individual will prolong a sound that could last longer than a second to a duration where it feels like the speaker might appear to be stuck in that sound. A normal dysfluency can be characterized by repetitions. These are brief. They're usually one iteration, usually at the word or the phrase level. It could be a filled pause. This is when we say sounds such as or They can be false starts. This is when the speaker starts, they stop, and then they start over again, or a parenthetical remark. These are phrases that typically hold the speaker's place on the floor while speaking, such as the words such as like, you know, I mean. Stuttering behaviors can be characterized by repetitions that happen 3 or more times at any level of the word or within a phrase. They can be at the sound level of a word. If I was going to say the word snake, it might sound like snake. It could be a syllable. If I was going to say the word something, it could sound like something. Or it could be a repetition of the entire word. If I was going to say the word I, it could be I. Repetitions can happen at the phrase level. It could be repetition of the whole entire phrase, or it could just be parts of the phrase. If we were going to say, I want to go out, and a partial repetition would be, I want to go out. Prolongations, this is when we hold a sound out longer than expected. If I was going to say the word moment, I might be have a prolongation on the M, and it could sound like moment. A block would be the fixation in the airway, or broken words are brief blocks of air that occur in the middle of the vowels. If I was going to say the word like, there might be a block on the I part, like. Individuals that stutter may also demonstrate tremors on their face, and this could be indicating some sort of struggle. There are about 3 million Americans that are stuttering today. Stuttering is not due to an individual's mental, physical, or personality traits. Stutterers typically have normal cognition. They know what they want to say, however, something is happening and it's preventing them from saying it. There's no certainty of the cause is related to genetics, environmental factors, or neurological issues. An individual who stutters may experience secondary effects of frustration, anxiety, avoidance, lower self-esteem. These could all be due to the inability to communicate their messages, their wants, and/or their needs. Stuttering may also lead to secondary escape behaviors, and these are characterized as physical gestures such as facial grimaces or body movements that initially help the speaker's words come out more fluently. However, these gestures begin to fade in their effectiveness, and it can be common for the speaker to develop another secondary behavior to add on top of the first one. So over time, this can become problematic as the speaker's having a series of gestures to have to carry through in order to speak fluently. Escape behaviors can be characterized by distracting sounds. They could be noisy breathing, whistling, sniffing, blowing, clicking. It could be facial grimaces such as jaw jerks or tongue protrusions, lip pressing, jaw tension. They could be head movements. It could be poor eye contact or movements of the extremities. They could be hand and arm movements, torso movements, foot tapping, hand tapping, arm swinging, etc. Also, stuttering behaviors could be avoidance behaviors. This is changing words, postponing what we want to say, or using hand gestures instead of speaking altogether. This is problematic for the speaker as they're now adding a physical component of their bodies when they're talking. Additionally, these gestures, along with the stutter, can interfere with the listener's ability to pay attention to the spoken message because they may be more focused on the delivery. So if you or your child is demonstrating stuttering-like behaviors, you're feeling frustrated or have negative feelings towards one's speech, developing secondary gestures, or you find the ability to speak interfering with your ability to generate a message, I recommend that you consult a speech-language pathologist for further testing and treatment. There's no overall cure for stuttering, and therapies are designed for the speaker to gain a feeling of fluency control. We want you to provide an understanding of how we use our bodies for speech. We want you to identify the moments of stuttering, help eliminate any stigma one may face, as well as identify the best tips and techniques to gain a better sense of control over their stuttering episodes. Thank you.